Hi, I'm Dr. Robin Fogle. Some couples are not able to achieve pregnancy with the woman's own eggs and may require donor egg IVF. This may be the case in situations of premature ovarian failure, where the woman experiences early menopause, or in cases of diminished ovarian reserve, where the quantity and quality of remaining eggs in the ovary are not sufficient to achieve a pregnancy. Genetic abnormalities carried by the woman, like cystic fibrosis or sickle cell disease, may also lead the couple to consider using donor eggs so that the disease is not passed on to the offspring. Also, women who do not respond well to our stimulation medicines or who have failed IVF cycles in the past using their own eggs might need donor eggs. Lastly, women with advanced reproductive age have a much higher chance of successful pregnancy using donor eggs and may consider this option. When donor egg is used, the donor undergoes the IVF stimulation as previously described. The recipient mother must also take medications in order to prepare the uterine lining to receive an embryo for implantation and pregnancy. This is achieved with estrogen, which can be taken orally, vaginally, or in the form of patches, followed by progesterone in the form of vaginal suppositories or sometimes injections. In women with irregular cycles, we sometimes administer Lupron shots at the beginning of the cycle to make sure premature ovulation does not occur. Studies have shown repeatedly that this simple regimen is ideal for preparing the uterus for pregnancy. Pregnancy rates with IVF correlate with the age of the eggs being used. Our highest rates of success are with donor eggs, with pregnancy rates per transfer close to 70%. Women under 34 do similarly well with pregnancy rates ranging from 55 to 60% per transfer. These success rates decline slightly as the woman's age increases. In 30 to 40% of couples, additional embryos are available for cryopreservation. A frozen embryo transfer cycle gives a couple an additional excellent chance at success, with pregnancy rates of 55% per transfer. Because most of our couples opt to transfer 2 embryos, or more if the age is an issue, twinning occurs in about 30% of IVF pregnancies, whether the embryos are fresh or frozen. Because we are uncomfortable transferring too many embryos, triplets are rare, with less than 5% of pregnancies resulting in triplets in our clinic. Those using donor eggs have twins in almost half the pregnancies. Transferring embryos one at a time reduces the risk of multiple pregnancy. Those not transferred can be frozen if they develop into normal blastocysts. This slide depicts 4 other features of our IVF program that you might want to know about. They show our outcomes for 2006 and 2007. The blue bars indicate the chance that your cycle will be canceled before egg retrieval. Note that the chance increases with age to about 15%. The red bars indicate the chance that you'll have a blastocyst transfer, which is as high as 40% in IVF for young patients and 60% for those using donor eggs. The green bars indicate the implantation rate, or the chance that an individual embryo leads to a fetus on ultrasound. Once again, age is the major influence, with implantation rates of about 50% with donor eggs and 40% in young IVF patients. Note that less than 10% of embryos attach in women over the age of 40. Also note the high implantation rates with frozen embryos, both in IVF and donor egg therapy. The yellow bars show the chance for embryo freezing. The prospects are strongly related to age because the number of eggs that develop is strongly related to age.